health policy, and this is our first lecture. So in this lecture, you should be able to know the definition of a health policy. Let's make sure you move the page down. Why am slides refusing? Okay, so I will use the mouse. So I was basically saying that this is the first lecture on health policy. So in this presentation, we should be able to know what health policy is, who are the people who actually make health policies, what are the different categories of health policies or policies that can be made, what are policy documents and what are policy instruments, how do we use them, and then why do we actually have to enact health policies? So that's the aim of this, those are the objectives of this session. So let us first understand the basic terms used in this presentation. When we talk about a policy, we are basically referring to decisions that have been made on what needs to be done on a particular situation. Okay, so they can be guidelines, they can be rules, they can be regulations on what needs to be done in particular situations. That's basically policy. Okay, so that means that a policy comes into place if there are decisions that have been made on how particular situations can be handled. So the government is the one usually responsible for making these policies. So we refer to policies made by the government on any area as public policy. Okay. Now, under public policies, where you can have health policy. Okay. So any decisions or any guidelines, regulations, incentives that govern a health system with the aim of making sure that people have access to quality and affordable healthcare services. That's what we call health policy. Okay, so you can actually say that a health policy is a document that specifies the decisions or the guidelines that can be made on a particular health situation. Okay, so we have different, of course, under health policies, we have different policies under it, or we have different problems that can be addressed with specific health policy regulations. Okay, so together with the health policy, we have the healthcare law. Okay, when we talk about healthcare law, this is now the application of legal instruments to govern the operation of healthcare industry. So it also includes issues to do with what are the constitutional rights of the members of the public, the healthcare workers, or the health providers, or even the statutes, the regulations, and even the court ruling. So we look at the general legal framework under which the given healthcare system operates. When we look at that, that is basically the healthcare law. Okay. So those are basically the terms. In our presentations, we shall be interchanging. We can say public health policy. We can say health policy. We can say healthcare policy, but they basically refer to the same thing. So the aim of basically this policy is to make sure that the population is having better health outcomes. It's about protecting, promoting the health of population. So these policies are basically guiding against any health threats that can occur to the public. Okay, so understanding it further, when the government makes decision on what needs to be done, who is to implement it. This is let me just say, a health policy is when you basically have decisions that have been made on how particular problems ought to be handled. And usually, the government is at the center, but also organizations can have their own health policies. Okay, but basically the aim is to make sure that the health of individuals or populations is improved and also protected. Okay, so usually health problems address a health policies address a health problem. Okay, or health policies address public health problems or issues. That's something that you need to note. So there are many issues that can affect the health of populations. Okay, access to healthcare, access to insurance services, public health systems or public health services, medical education or health education. So if you are going, if you talk about the scope of health policy, you are referring to what are the areas that can be addressed by a health policy. Of course, these are not the only areas that can be addressed by a health policy. So basically, you also need to understand is that health policies cover any problem that can occur to populations. Okay, so problems can emerge from public health, can emerge from provision of medical services, whether it is through under insurance or it is through out-of-pocket payments, issues to do with how doctors or how health providers are trained, issues to do with where are hospitals going to be built? Do you have to pay money to access the health services in these hospitals? Who buys the drugs? How are the drugs used? How do they enter the country? Any aspect to do with the health system is covered under the health policy. So the health policy covers a number of aspects to do with finance, human resource, issues to do with the where to put the resources, or what medical resources do you need? Okay, what drugs do you need to procure? Which equipment do you need to procure? What amount of budget is allocated to the health sector? So all these fall under the health policy. So the scope of health policy is quite wide. So why do we actually interest ourselves in understanding the healthcare policy and law? Of course, we have laws that govern the provision of medical or healthcare. Okay, so if you don't understand the laws, then you are most likely going to be taken to court and you face liability. So we need to understand the laws such that we can comply with the laws. But also there are situations where we don't have sufficient policies that address our problems. Okay, so we can advocate for policies to improve the health of our patients. And then also understanding the process of making policies can enable us to make informed decisions about how resources can be allocated and what type of services can be delivered and how they can actually be delivered. It also allows us to know our rights as patients or as health providers, what options are available to us within the health system, or what are the limitations and what limitations are there within the health system. Okay, so those are issues that that are very important that we actually know. So there's this error here. Let me try to eliminate it. It's not health system, it's just health system. Okay. Just as it loads. Yeah, so the next point is, of course, if we know about health policy, we can engage in constructive debates such that we can create a change for the better of the population. Okay, and also, if you understand the dynamics of health law, you can be able to sue, or you can take what you call a legal recourse for in situations where you think there is negligence, or there is malpractice, or there is discrimination. Whatever issue that you may face, these basics allow you to be able to pursue the legal course. So generally, like I said, health policies and laws protect the population. So how do you protect the population? Is by ensuring that the population has access to healthcare services that are actually of quality. You also don't want people to go to health facilities and then they spend a lot of money. So you want to control the costs, and then you have issues to do with uh, patients, protecting or respecting patients' autonomy, and then also allowing for research to be carried out. Okay, so if there are no laws, if there are no policies, it means everyone can do whatever they want. And this will include even harming patients. So if you have laws and policies, it means we are protecting the patients, we are protecting their right, and research can be done in the appropriate way. And everything that, even including activities that can damage or that pose a public health threat, actually kept in check. Okay, so that's the importance of healthcare policies. So these healthcare policies can be categorized into three: redistributive policies, regulatory policies, and allocational policies. So we are going to look at each and see what they actually mean. When we talk about redistributive policies, this is where the government imposes costs on individuals who are doing activities that are not good to population health. And also, it involves providing incentives to people who are doing the right thing. So it's about taxation, taxing, for example, for people who import things that may damage the population or individuals. For example, alcohol, cigarettes, those one is a tax. The tax is actually increased, okay, to make sure that they actually limit the importation, okay, but also limit the people who consume these items, okay, because if you don't have the money to buy, it means you're going to be on a safer path, especially for alcohol, for things like tobacco. And then for people who are let us say who import, let us say medical equipment or drugs, then you don't have to charge them a lot. Sometimes we have what you call tax exemptions, okay? Or you actually subsidize if someone wants to make a plant that manufactures drugs, then the government can actually give them some money to make sure that they can accomplish their goals. Okay, so these are basically what we call redistributive policies. And then we have regulatory policies. Okay, these ones impose only restrictions. Okay, things like settings, giving sanctions, or setting guidelines that limit or control behavior in certain establishments. Let us say smoking, for example. You don't want people to be smoking everywhere because of secondary smoking. So you have a policy that regulates where people smoke, okay? Where cigarettes is actually being sold. People should not be allowed to sell cigarettes to underage people. Issues to do with the bars being open in the morning. restricting the time for which people can actually go to bars is also one the regulatory policies. So it's about restricting, putting restrictions of particular behaviors that are dangerous to health. And then we have allocation of policies. This one basically deal with allocation of funds, okay? For any intervention, or we can say that for public health interventions that improve the welfare or the well-being of communities, then you can have the government allocating more resources to that area. So if you have the government policies shifting to allocating more than 15% of the national budget to health, then that is a policy which we can call allocational policy. Also, allocational policies can relate to even allocating funds to interventions for, let us say, marginalized populations or vulnerable populations. So let's go and look at now what we call policy instruments, okay? And this actually relates to what we have just looked at. When we talk about policy instruments, we are referring to tools and mechanisms employed by authorities, we can say government, to implement and enforce policies effectively. Okay, so for example, if there is a problem of, let us say, teenage pregnancy, okay? Teenage pregnancy, the prevalence is extremely very high. What can the government do to make sure that the problem is addressed? So what policy instrument can they use? So that's basically what we are referring to. So the examples are related to the ones that I've just described. One is the fiasco tools. These are tools related to money, okay, or finances. I've given examples of the smoking, the importation of tobacco, issues to do with alcohol, and then subsidies for people who are doing good things, and then also budget allocation, allocating money from the national budget to address certain problems, okay? And then we have regulatory tools. Licensing, for example, if we talk about the training of health workers, you first have to license the schools, okay, and then accredit them. And then also, when you recruit them, you want to see their performance, okay? So these are also very important. So these are tools that the government can use in tackling any problem. And then we have informational tools, issues to do with public awareness, campaigns, and educational resources. And then marketing, market mechanisms. For example, the government can decide to involve itself in in the provision of a particular service. This can regulate the market. Okay, it creates competition, and then the prices actually come down. So if the government actually involves itself in some of the things, it can help in addressing some of the health problems. Okay, so those are the policy instruments that the government authorities can use to address any policy issue or any health problem. So who are the people who make the laws? The legislation, the legislature, okay? The legislature, and then we have the regulation, and then we have the court rulings, and then international agreements. So we're going to look at each of these and see what they actually mean. The legislature, which is basically the law-making body or arm of the government. You can call it the National Assembly or the Parliament. Okay, so the laws can be made by the Parliament. Okay, in different places, in different countries, the legislative branch of the government can be called the Congress, or it can sometimes you can have a country like US which has the Congress, then the Senate. Okay, but basically that's the legislative government. So they make these laws, then it's them. Okay, and then we have the rules and standards that implement and enforce the regulation, okay, or the legislation. So if the legislative arm puts down the policies, and then you have other arms of the government that are very important in ensuring that these policies are actually put in place. Okay. You also have sometimes the executive playing an important role, releasing what we can call executive orders. Okay. And then these can be implemented by the different organs or agencies within the government, especially under the Ministry of Health, where you can have different departments that are responsible for enforcement. And then we have the court rulings, okay? Like we earlier on said, you can have a litigation where even a private citizen decides to take the government to court, okay? And then the Supreme Court can make a ruling. And when that ruling is made, it becomes part of the policy. So we have some rulings, for example, in the US, and then also in the UK, that actually became very influential on health policy. Okay, for example, the cases that we quote here, the first one in the US is related to, or it's about a case where a citizen took the government, the state government, to court over the right for abortion. Okay, and then the court made its ruling that the patient has the right to make a choice on abortion. And then the case in the UK is about a client who went to a gynecologist, and then actually the gynecologist did not give all the information related to the state of the pregnancy, and then the woman gave birth to a child who had serious birth injuries, and this case was taken to court. The patient claiming that had she received all the information about the proposed method of delivery, she could have made the right choice, and the child wouldn't have gotten the serious injuries. And therefore, the court ruled that indeed all health providers need to provide complete information about the benefits and the risks associated with the treatment that they are actually receiving. So this is actually standard practice now. When you encounter a patient, you provide the patient with complete information regarding the benefits and risks of any procedure. So courts are sources of health policies. So that becomes the standard. And then we have policies that are issued by international agreement. International bodies, for example, that become incorporated into the national policies. So, for example, entities such as WHO are very, 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 very important in issuing out policies, and then these policies can be adopted by the national governments. Okay. Or you can have situations where the government becomes party to international agreements and then implementing those agreements as part of their policies. So let's look at what we call policy documents. Okay, so policy documents is basically an official communication from any agency, whether government agency, outlining the goals, strategies, and frameworks for addressing specific problems. So they can be written by any government agencies or health departments, advocacy groups, or even private organizations. Okay, they can be called different names. They can be called a white paper, position statements, guidelines, legislative approvals. The names can vary. So these documents usually have the executive summary, the problem statement, background information, aims and goals, and then the implementation strategies, evaluation plan, resources, the resources, and then the budget. Okay, so this is basically to say that, for example, where in countries where we have what we can call mature politics in courts, or in strong democracies, even political parties that are not in government have policy documents on problems that the citizens are facing. Okay, such that when the election time comes, the population actually knows that if we elect this party into power, this is what they will implement, because they understand their policies on different matters. Okay, so it's not about bribing voters, but the leaders are voted into power based on their policy or policy documents. Okay, so organizations still can also have policy documents on different policy issues. For different purposes. It could be for issues to do with advocacy. It could be issues to do with creating awareness, and also basically to allow the population to know that these are the options that can be undertaken if we are to address this problem. Okay, so the policy document contains those areas that we have just listed. The executive summary, which has the brief overview of the goals and the proposals to the problem. But remember, a policy has to be addressing a particular problem. Okay, so the executive summary contains the goals and the proposals to address the problem. And then what is the exact problem that is going to be addressed, that is covered under the problem statement. And then the background information provides context and supporting data. And then the goals and objectives of the policy. Okay, so I've said that the policy document is very important in guiding action. What needs to be done under what situation? Okay, what do you aim to achieve? What are the goals? And then also persuading decision makers such that they can support given policy proposals, and then also communicating information about healthcare issues and the possible solutions to these healthcare problems. So that marks the end of this presentation. If you have any questions, you can